is at a healthcare facility in Rosettenville, in the eastern part of Johannesburg. Nqobile, you can hear a divergence of views around this, but the experience is, and we're hearing from activists who are blocking people from entering those facilities, saying that it's because they are being deprived care, and it has led to some confrontations in certain areas. So talk to us about the picture where you are.
Oh, yes, indeed, Iman. In fact, they're saying that at this point, they're looking at the fact that South Africans need to be attended first. According to some of these activists, and I'm going to step out so you can see, who are currently here, they're saying that basically them guarding the area specifically looks at the fact that South Africans are not deprived of some of these clinical services that they require in this area. However, at this point, it does look a bit quiet, mainly because they've been here for quite some time. So I want to bring in a lady who is also a community member in this area, but also helps in terms of the clinic. Mama, at this point, we are hearing from what these various groups are saying, but is this working out right here?
With regards to their demands?
Yes.
Actually, hence this group has been here from the beginning of the week, and then we had to intervene with the Lendo councillor because they have mentioned that they will not allow non-South Africans to be island attended to. And in our ward, in this, from the council point of view, as the councillor had already alluded earlier on, that we have to help all those people according to our constitution.
All right. And as someone who's part of the committees within the area, what are the issues that you are seeing that are maybe prevalent in this area with regards to health, and what the groups are saying March on March that is blocking at this moment?
Okay. What I have observed here in this Lendo clinic, the Lendo problem here, this clinic is overcrowded. I would say around about 70 to 80% of foreign nationals that are attending this Lendo clinic. And on the other hand, there is what is happening here, which is the identity theft. Because we've had quite a lot of cases that were reported to me even last year. And we had called the police from Moffat View Police Station to attend and arrest those people. When I say those people, I want to be specific. Foreign nationals that had used South African IDs, because some of these South African IDs that they use, they rent them or they pay South Africans. You'll understand. And then you find that maybe 4 or 5 of them, pregnant women, using one identity card.
Those are strong allegations, Mama. Is this something that you have brought to perhaps the Department of Health, where you guys have noticed that someone is using a South African ID when they're not?
Yes, Nqobile, we do have proof, because they felt that police were called in my presence. Yeah, in some of these cases, not all of them. They were brought to Moffat View Police Station. And then after that, it was just quiet. It was not one case. Nothing happened after they were taken by the police. Yes, in full view of people here.
So Mama, maybe what would be the solution in this case? Because we know that as part of rights for people who are South African and who live in South Africa, they all have a right to health.
I think in this meeting that will be engaging all stakeholders, we would love to have some of the departments, like the Home Affairs Department, should be part of that. Immigration as well. Because most of these clinics, they are suffering precisely because these very same people, they go to this clinic today, Rosenville Clinic, and then there's no record. Then after 2 days, they go to another clinic, you see, and then they'll be attended to because they are patients. but it is not right at the end of the day. I'm not trying to be xenophobic, but I want to address this issue, you know, because I am involved in this clinic, you see. And also the number of the patients that are being attended to by the professional nurses, I don't think it is fair. For one person on a daily basis, attending to more than 60 patients a day, you know, how would you expect them to be productive at the end of the day? These people that are working here, they have families, you know, at the end of the day. They are human beings.
I do believe that's something that you perhaps need to also bring towards the Department of Health to highlight such issues. And I want to bring Iman, what the lady is speaking about here, is just explaining to us about the sort of work that they do as part of the committee within the area, but also as people who live in this area. They talk about how there are so many people that come to this clinic, and that really speaks into the fact that most of our departments of health facilities are seeing quite a lot of people going into these facilities, and perhaps there might be more than what they have in terms of the people that are working there. But this is an issue that has been highlighted before, and what she is also explaining here is that they feel that at this point most of the issues that they've brought forward have not been attended to, and one of them is the identity issue. They feel at this point that there are some identities that are being used which are from South African people but not necessarily by South Africans, and these are things that they've brought to the police for. But it highlights what the councillor was saying, that if there are issues like this, then the Department of Home Affairs must be brought in to talk to these issues. But of course at this point we know that there is that group March on March currently at the gate, just saying that they will continue to monitor this area until South Africans get the service they deserve.
All right, Nqobile Madlala, thanks for that. And there is, as we said, a growing trend of this happening across Gauteng. And let's talk about it more with